Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Vijay Rajput. He is an internal medicine physician, and his Kevin MD article is titled "The Top 10 Things New Interns Should Do." Very relevant in the start of the academic year. Vijay, welcome to the show.
Thank you, Kevin. Nice to have you being here.
We'll get into your article in a little bit. First off, briefly share your story and journey to where you are today.
I was born and raised in India, did a medical school in India. In India, we go from high school to the med school, completed medical school, wanted to be a surgeon, finished general surgery, and wanted to be a plastic surgeon. But started dating a classmate who has a relation here in the United States, came on a chain migration in the United States in 1992 on a Philadelphia. In March, so ended up taking a transitional year rotating internship. And then my wife said, you better find a short residency rather than do surgery, plastic surgery. So I ended up matching in Robert Wood Johnson Medical School in Camden, New Jersey. And that's it. 1993 to 2015, I spent my internal medicine academic practice and a medical educator. And then things changed in my life. And last 5 years, I've been in New Florida, where I've been now at Nova Southeastern as a department chair of medical education, and I still teach medical student and administer medical education.
Now, tell me, as a medical educator, what are some of the challenges and rewards that you face daily?
The challenges are the same. I treat patient and a learner in the same way. I think you do the same thing for a patient, and I think you same to do for the learner. And I have sort of used a similar principle. Both require a listening, both require caring, and both require going a little bit extra mile. You have to end up doing something not in your job description. I think that's a simple principle for both my students, resident, as well as my patient. But challenges are contemporary, and I think the biggest challenge I really worried about the shifting from bedside, that mindfulness, giving 100% to my patient, he's interfering with a lot of minutiae or whatever you call, whether it's a computer or my iPhone or my pager or that distraction. And I'm trying to figure it out how I can bring my learner and my resident to give that 100% to my patient when they're in office or ER or the bedside. But that's the biggest challenge I see in a clinical practice.
Now, you've been working with medical students and medical trainees for a while now. Have they changed over the last 5-10 years? Have you noticed any changes?
I think they are still a good students. So I don't want to take it, and they are learning different way. So I think we all need to figure it out and adjust ourselves. My biggest concern, and that may be the part of us, is this understanding of work-life balance. And I really believe that the medical profession and your personal life is a juggling. There is no balancing act. There are constantly you juggle. And I still remember one of my professors have told me that, Vijay, in your life, there are 3 crystal balls you're going to constantly juggle. One is your personal life, one is your academic professional life, and the third is integrity. And you have only 2 hands. So you can't going to break the integrity, because if you break integrity, you don't have any of those. So the 2 other things you're going to juggle, and an issue is how far you throw up in the air. You want to make sure that you don't throw far up, that you will break that part of the, whether a professional or personal life. But I think that's where the challenge is. I really believe the work-life balance is not the right way to go. In medical profession, we need to train our learner and resident that get into used to how to juggle your professional career and your personal and a family life.
All right. So you give more advice in your Kevin MD article titled "The Top 10 Things New Interns Should Do." As we all know, July 1st is the first day that graduated medical students go onto clinical rotations, and it's really jumping into a completely new world from medical school. So I remember when I was an intern, my first day was night float, and I remember just yesterday was I was a graduated fourth year medical student, and the next day people were calling me overnight for all these issues for people in the hospital, and it was such a big jump for me. So tell me about your article. Talk about it for those who didn't get a chance to read it.
Yeah, so the reason I came up because I have done a three internship in my career. One is a surgery in India. Then I did a rotating internship in Philadelphia and then internal medicine residency at Robert Wood Johnson Medical School. And every time I thought I'm already done a two internship. I'm pretty smart. And then I realized that I have struggled every time. Then I realized there are things which are simple, but it's not been told. It may be as simple as start early or get a help from the nurses or everybody. So that leads to me to come up with these 10 important points, which are nothing to do with really a medical knowledge or your specialty or expertise, but a simple thing which you can instill right in the beginning of the internship. And if you carry with you, I think that's how I became a better doctor. I'll tell you, that's the whole reason. And some of those are as simple as asking for help.
Mm-hmm.
Nobody teaches. And the reason is I remember I've read somewhere and the most two things when a student become an intern, they're fear of. One is they don't want to look stupid and they don't want to hurt anybody, right? Every day, the first day, I'm sure when you became night float, Kevin, you really was worried that I make sure I don't hurt anybody and I don't want to look stupid. So those two things stays with you. And all these 10 things what I've said can help you to overcome, whether it's getting up early and asking for help or just being early part be more effective rather than efficient. And I know the way we have created a system that efficiency is rewarded. We know that. And the intern, your resident saying, oh, you better get it done this 5 HNP rather than say, oh, I'm going to take a little bit longer. And then duty hours came. And then duty hours really made people to become more and more efficient rather than effectiveness. So those simple things, even like thinking about rescuing rather than treating complication. I still remember the ICU fellow will come and they will not take the patient into the ICU early and somebody's taking and say, oh no, you need to take it patient and prevent the complication. But you will have that patient crashing on the floor and then rescue it. And then everybody say, uh-oh, we saved the patient. So those are simple things we can do, as simple as writing a prescription to think about allergies all the time and think about where the drug metabolizes in liver and failure. And the most important thing I tell resident that everybody's watching you all the time. You make sure that you are watched by everybody. So those simple things can make you, I think, a better resident, better intern, and you can practice well rest of the time in your career.
Now, when people graduate medical school, they already have to have a lot of skills just to make it through that whole pre-medical school process and then medical school and then finishing medical school. What are some added skills that interns and residents should have that isn't necessarily taught in medical school?
Yeah, that's a great, excellent question. And I have called that as a 0 hour milestone. So you graduating from medical school, nowadays they call it EPS, on the very first day. And a simple skill is calling a consult, right? Nobody teach you and say how effectively, efficiently you can call a consult in 2 minutes and explain the consultant very effectively that what you really looking for, as simple as this. The second one is pronouncing patient. That you see lately literature, but I will tell you, nobody ever taught me how to pronounce a patient. Not the pronouncing patient when crisis, but nowadays patient die in the hospital, end of life care, palliative care, even those situations, nobody tell you how to do those. So as simple as providing a calling for a consult, and the rest is just talking to your peers and how to effectively communicate with the nurses, talking to your ER peers, calling to the ICU team, calling to the OR team. Those nuances, I think we still not teaching our resident very well, which is nowadays there is a movement called transition to the residency, TTR, and there are schools now developing couple of curriculum, but still I think it can be integrated very well across the curriculum and make students ready for that 0 hour milestone.
So one thing that you mentioned was the relationship with the support staff and the nurses. And I think that's absolutely critical because they can make and break your intern and residency experience. So talk more about how new interns can build those relationships with the nurses?
So the most important is introduce yourself to everybody, which starts from your security desk in a front hospital. It can go into the janitor. It can go to the nursing staff, pharmacy staff, cleaning staff, anybody. When you meet, just go and tell yourself who you are. And I also have told that even in a patient room, even you think you've been taking care of the patient every day, you should introduce yourself every day to the patient with your name and introduce the team. I also have told that there is a little bit stigma in our country with the word intern. And I actively try even myself introduce my intern as a junior resident and my senior as a senior resident. Because in the general layman, the intern means the one who just bring the donuts and bring the coffee. So there are a few things like that can help you. And the other thing I've learned and really help, give your first name and ask the people. Do never call, hey nurses, hey student, hey pharmacist. It will, if you really want to bond a relationship, a long term in the hospital, start knowing people's name. And even if you forget, I will tell you, it gives you so much mileage when you call somebody with the nurses. It's such a beautiful thing to do. And all we are is pretty smart enough to remember people's name. It can help you to the bond relationship. And when you call that same person in the middle of the night and say, hey, I'm Vijay. Hey, Kevin, how are you? I really need help. And Kevin will never say no to me.
One of the things that you mentioned when we first started off was juggling the crystal balls that these new residents are going to have to handle. So I want you to go into more detail on that. How can these new residents, how can they juggle all these crystal balls between their work life, their home life, and their integrity? What are some tips that you can offer to help them?
Yeah, I think lately, whenever I introduce myself to the first year medical student, I start with a statement. I want to make sure that you not land up in a jail in this profession.
That's good.
And they get all shocked and say, really, Dr. Rajput, I'm here to came and have a great career and you telling me not to go to the jail. And then I elaborate and I said, let me give you the story. And the most powerful story, which usually I tell them of, the Clayton Christensen, who is the one who have written a lot about disruptive innovation. When he gave a commencement speech in Harvard Business School, and he said, I'm from 1972 business student class. How many of my colleagues who are in a jail right now? I think this was somewhere around 2004. And he said 7 of them are in the jail. And that's exactly, I think the you will should avoid doing called a marginal cost mistake. And you should do the right thing when nobody's watching you, right? Those are the 2 most important thing I usually try to convey. And there are a lot of slippery slope. There are a lot of places we as a physician and you we see all the time. We hear in lately in the news, just last week or 10 days ago, the physician killed himself in a Rikers prison after he was charged for some really egregious issues. The people have gone, the physician have gone to the jail. So there are places where you might lose or opportunity to lose your integrity. So my only said, make sure you don't end up in a jail. That's the most important thing. So that's the integrity part. And for a student level, a lot of time the simple lapses, even academic integrity or managing. I mean, just yesterday, there is a lawsuit in the United States. The student complained that it is remote exam
Mhm.
and the proctor wanted to see around in the room and a and a judge went in a favor of and say, hey, he's breaching your privacy. So the question is, higher education wanted to maintain the integrity of assessment, and that was the reason they wanted to make sure that the student taking it home and a student saying about breaching the privacy. So these are the fine nuances I really want to make sure. And the most important thing, do not breach that integrity. Don't make any marginal cost mistake and do the right thing when nobody's watching you.
I want to talk about burnout because that's something that's a common theme on my site and that's affecting not only attending physicians, but also medical trainees and medical students as well. What's your experience with burnout in medical education, and what are some ways that we can help when these occurrences happen?
Burnout is real, but there is a lot of things that have been blamed. And I think lately we are trying to get this juice or a mojo from a wrong place. I personally believe you cannot dissipate burnout by going for a yoga or doing a mindfulness technique. You need to get out of burnout by meaningfully engage in a clinical care. The juice has to come by providing a good care to your patient. I think patient give you that. So a couple of things I really I've been talking about is curiosity, right? If you've been cultivate your curiosity every time in the middle of the night, if you're a resident, and if you think that it doesn't make sense what is in front of me, this patient, let me go one step further. And that making that brilliant diagnosis, that aha diagnosis with that curiosity will not let you burn out. The meaningful engagement and that engagement with your patient, that what I was about giving 100% in my article, meaningful engagement with your peers, your staff. I think we are underestimating the power of that profession. And if you don't give that power and try to get the power from the profession, you're going to get burnout. And I don't think just doing a mindfulness and yoga will help you. It might help you temporarily.
Mhm.
And the one other thing is you can prevent burnout. I really with the two other things. One is a respect. There is respect is like a air. I have read somewhere. The moment you take out the respect, you will understand. So don't demand for respect, right? On the respect. And the one other thing is a part of the work we do it is provide, which is Amy Edmondson have said very clearly, is called psychological safety. We all need to provide that emotional, cultural, psychological safety to each other so that allow us to grow and fully engage. And I really believe the burnout, you can avoid it if you meaningfully engage in a patient care or clinical care.
We're talking to Vijay Rajput. He's an internal medicine physician, and we're talking about his Kevin MD article, The Top 10 Things New Interns Should Do. Vijay, what are some of your take-home messages that you want to leave with the Kevin MD audience?
The most important for a new resident is there is always a help. That's one. The second is it is not all about competency. Learn the good judgment from the role model. And I think lately we are all talking about a competency, but the judgment is what's going to make you a better doctor. That's allow you to deviate from evidence-based medicine practice and still do the right thing in the patient in front of you. And I really believe you need to go extra mile. And in my extra mile meaning is something you should do every day, which is not in your job description. That's in my mind, whether that's as simple as giving a glass of water to the patient when waiting for somebody else to give a glass of water, or anything you do, go extra mile. So those are my simple take-home message. There is always a help, and go extra mile, do something not your job description.
Vijay, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thank you, Kevin, for having me. Have a good day.